Welcome to Health and Life. I'm Sai, your medical expert, accompanying you on your journey to living a healthy and happy life. Today, we'll explore a vital health issue, especially for older adults: vitamin B12 deficiency. You've probably heard of it, but do you really understand its potential impact on your body? Why is this topic so important? Because it's a common problem. Statistics show that the rate of vitamin B12 deficiency in older adults is increasing. Don't be complacent if you or your loved ones are entering this age group. Profound impact on health. Vitamin B12 plays a pivotal role in maintaining blood cell function, ensuring mental clarity and body flexibility. Vitamin B12 deficiency can lead to serious consequences, directly affecting quality of life. Often overlooked. Unfortunately, vitamin B12 deficiency is often underestimated or mistaken for other health problems, delaying diagnosis and treatment. Understanding the importance of vitamin B12, I want to provide you with the knowledge you need to proactively protect the health of yourself and your family. In this video, we'll explore: what is vitamin B12 and its role in the body? What causes vitamin B12 deficiency in older adults? What signs warn of vitamin B12 deficiency? How to effectively diagnose and treat vitamin B12 deficiency. And before we begin, if you find the information Health and Life provides helpful, please don't forget to hit the subscribe button so you don't miss future videos. Your support is a great motivation for us to continue bringing valuable health knowledge. Now, let's start the journey to explore vitamin B12 right now. What is vitamin B12? So, what exactly is vitamin B12? Vitamin B12, also known as cobalamin, is a water-soluble vitamin that plays an indispensable role in many essential biological processes in the body. Imagine vitamin B12 as a miniature factory, involved in the following stages. DNA synthesis. Vitamin B12 is an important component in creating DNA, the cell's genetic blueprint. If vitamin B12 is lacking, this process will be disrupted, affecting cell development and function. Cell division. Vitamin B12 plays a key role in cell division, especially blood cells. Vitamin B12 deficiency can lead to anemia, causing fatigue and weakness. Nervous system function. Vitamin B12 is the protector of the nervous system, helping to maintain the myelin sheath that surrounds nerve fibers. This sheath plays a role in transmitting nerve signals quickly and efficiently. If vitamin B12 is lacking, the nervous system can be damaged, causing problems with memory, thinking, and movement. Where can we find vitamin B12? Vitamin B12 is mainly found in animal-derived foods, such as meat, especially red meat, fish, poultry, eggs, milk and dairy products. For vegetarians or vegans, getting vitamin B12 from food can be difficult. However, some fortified foods, such as breakfast cereals, also contain vitamin B12. So, how much vitamin B12 do we need each day? The recommended daily amount for adults is approximately 2.4 micrograms. However, needs may increase for pregnant and breastfeeding women. What happens when we absorb vitamin B12? After being absorbed from food, vitamin B12 is stored mainly in the liver. The body has the ability to store vitamin B12 for a long time. But regular supplementation is still important to maintain optimal levels. How does vitamin B12 absorption occur? This process is quite complex and requires the coordination of many factors. Stomach acid. Stomach acid helps release vitamin B12 from food. Enzymes. Digestive enzymes help break down proteins, facilitating vitamin B12 absorption. Intrinsic factor. This is a protein produced by stomach cells that binds to vitamin B12 and transports it to the small intestine for absorption. Thus, for vitamin B12 to be absorbed effectively, we need a healthy digestive system and sufficient intrinsic factor production. Next, we'll explore the barriers that make older adults more prone to vitamin B12 deficiency. Decreased stomach acid. Stomach acid plays an important role in releasing vitamin B12 from food. However, over time, the stomach lining can thin, leading to atrophic gastritis and reduced acid production. Some antacids, often used to treat acid reflux or stomach ulcers, can also reduce the ability to absorb vitamin B12. Prolonged use can exacerbate this condition. Metformin side effects. Metformin is a common drug used to treat diabetes. However, an unwanted side effect of metformin is reducing the ability to absorb vitamin B12. If you are using metformin, talk to your doctor about regular vitamin B12 blood level checks and supplementation if necessary. The influence of alcohol on the stomach. Drinking too much alcohol can irritate and damage the stomach lining, reducing the ability to produce acid and intrinsic factor. This leads to reduced absorption of vitamin B12 and other nutrients. Limiting or stopping alcohol use can help improve stomach function and the ability to absorb vitamin B12. Stomach or intestinal resection surgery. Surgery to remove part of the stomach or intestines can reduce the surface area for vitamin B12 absorption and reduce intrinsic factor production. This is especially true for stomach removal surgery. People who have undergone this surgery need to be closely monitored and supplemented with vitamin B12 regularly. Conditions causing malabsorption. Certain conditions, such as Crohn's disease and celiac disease, can damage the small intestine lining and reduce the ability to absorb vitamin B12 and other nutrients. Treating these conditions can help improve the ability to absorb vitamin B12. In summary, thus, due to many factors related to age and health problems, older adults often have difficulty absorbing vitamin B12 from food. This leads to the risk of vitamin B12 deficiency, affecting overall health. The common symptoms when the body lacks vitamin B12. Anemia. Giant blood cells. Vitamin B12 plays an important role in blood cell production. When vitamin B12 is deficient, the body cannot create enough healthy blood cells, leading to anemia. The special point of anemia due to vitamin B12 deficiency is that the blood cells are often larger than normal. Due to the effect on the cell division process, symptoms of anemia include prolonged fatigue. Even after resting fully, you still feel exhausted and lack energy. Shortness of breath. Even when performing light activities, you feel short of breath. Pale skin. Due to a lack of blood cells, the skin may become pale and lifeless. Peripheral neuropathy. Uncomfortable numbness. Vitamin B12 plays a role in protecting the nervous system. When vitamin B12 is deficient, nerve fibers can be damaged, leading to peripheral neuropathy. Symptoms of peripheral neuropathy include numbness, tingling, burning. Often occurs in the hands and feet, causing discomfort, loss of balance, difficulty walking. Due to damaged nerve fibers, the ability to control muscles and the sense of balance can be impaired. Cognitive impairment, impaired memory, slowed thinking. Vitamin B12 is necessary for brain activity. When vitamin B12 is deficient, brain function can be impaired, leading to cognitive impairment. Symptoms of cognitive impairment include memory problems, difficulty remembering new information or recalling old memories, slowed thinking, difficulty thinking, concentrating, and solving problems, personality changes, easily irritable, restless, or changes in behavior and emotions. Other signs, not sensory symptoms, warning signs. In addition to felt symptoms, some blood tests may show signs of vitamin B12 deficiency, such as increased homocysteine, an amino acid in the blood. High levels may be related to vitamin B12 deficiency and cardiovascular problems. Increased methylmalonic acid, MMA, a metabolite. High levels show that the body does not have enough vitamin B12 to perform important biological processes. If you or your loved ones have any of the above symptoms, especially when older, don't be subjective. See your doctor for examination and vitamin B12 blood level checks. Early detection and timely treatment can significantly improve quality of life. In the journey to discover vitamin B12, we cannot ignore a special character, which is pernicious anemia. The name may sound scary, but in fact, this is a form of vitamin B12 deficiency that we need to understand clearly. So, what is pernicious anemia? Pernicious anemia is a vitamin B12 deficiency due to the body's loss of ability to produce intrinsic factor. As we know, intrinsic factor is a protein produced by stomach cells that binds to vitamin B12 and transports it to the small intestine for absorption. Imagine intrinsic factor as a dedicated guide, helping vitamin B12 overcome the long journey in the digestive system to reach its destination. Without this guide, vitamin B12 will hardly be absorbed effectively. What causes pernicious anemia? In most cases, pernicious anemia is an autoimmune disease. This means that the body's immune system mistakenly attacks the intrinsic factor-producing cells in the stomach. As a result, the stomach cannot produce enough intrinsic factor, leading to reduced absorption of vitamin B12. What is the connection between pernicious anemia and vitamin B12 deficiency? Very simple. Lack of intrinsic factor right-pointing arrow reduced vitamin B12 absorption right-pointing arrow vitamin B12 deficiency right-pointing arrow anemia and other symptoms. Without intrinsic factor, vitamin B12 from food cannot be absorbed effectively. This leads to vitamin B12 deficiency, causing symptoms such as anemia, peripheral neuropathy, and cognitive impairment that we discussed earlier. One thing to note, although named pernicious anemia, not everyone with pernicious anemia has obvious symptoms of anemia. In some cases, neurological symptoms, such as numbness, tingling, or cognitive impairment may appear before any signs of anemia. If you suspect you may have pernicious anemia, see your doctor for examination and testing. Blood tests can help determine if you have a vitamin B12 deficiency and whether your body produces enough intrinsic factor. The good news is that pernicious anemia can be treated effectively by supplementing vitamin B12, usually through intramuscular injections or high-dose oral tablets. Early treatment can help prevent serious complications and improve quality of life. The reasons why vitamin B12 deficiency often hides and bypasses the attention of both patients and doctors. Non-specific and common symptoms. The symptoms of vitamin B12 deficiency, such as fatigue, anemia, neuropathy, cognitive impairment, and difficulty walking, are very common in older adults. They can be caused by many different factors, making it difficult to determine the exact cause. Remember that non-specific symptoms are the enemy of accurate diagnosis. Aging, the perfect disguise. A sad reality is that many symptoms in older adults are often blamed on the natural aging process. This leads to overlooking potential health problems, including vitamin B12 deficiency. Don't let aging become the perfect disguise concealing treatable health problems. Gradual progression. Vitamin B12 deficiency often progresses slowly and silently. Symptoms may appear gradually and increase over time, making it difficult for both patients and doctors to recognize the change. Small changes every day can lead to big consequences if not detected early. Normal, but not optimal, test results. In some cases, vitamin B12 test results may be within the normal range, but still at a low level. This means the body may not have enough vitamin B12 to function optimally, but not low enough to be considered a deficiency. Careful monitoring and evaluation of test results is very important. The importance of early detection. Although vitamin B12 deficiency is often overlooked, the good news is that it can be treated effectively by supplementing vitamin B12. Early detection and timely treatment can help prevent serious complications and improve quality of life. Early detection is the key to successful treatment. The potential candidates who should be screened for vitamin B12 deficiency. Older adults with suspected symptoms. This is the most important group of people who need to be checked for vitamin B12. If you or your loved ones have any of the following symptoms, see your doctor for examination and evaluation. Prolonged fatigue, unknown cause, anemia, pale skin, shortness of breath, numbness, tingling, or burning in the hands and feet, loss of balance, difficulty walking, impaired memory, slow thinking. Don't ignore any symptoms, even the smallest. Listen to your body and tell your doctor. Older adults with risk factors. Even without obvious symptoms, some older adults with the following risk factors should be tested for vitamin B12 regularly. Taking metformin. As mentioned, metformin can reduce the ability to absorb vitamin B12. Taking antacids. These medications can reduce the ability to release vitamin B12 from food. Have stomach, intestinal, or absorption problems. Conditions such as atrophic gastritis, Crohn's disease, or celiac disease can affect the ability to absorb vitamin B12. Drinking a lot of alcohol. Alcohol can damage the stomach lining, reducing the ability to produce acid and intrinsic factor. Vegetarians or vegans. Vitamin B12 is mainly found in animal foods. Therefore, vegetarians or vegans have a higher risk of vitamin B12 deficiency. If you have any of the above risk factors, talk to your doctor about regular vitamin B12 testing. Next, we will decode the testing process and the indicators related to vitamin B12. Step 1. Blood test, measuring vitamin B12 in the body. Blood tests are the main method to assess vitamin B12 levels in the body. Your doctor will take a sample of your blood and send it to the lab. In the lab, the technician will measure the concentration of vitamin B12 in serum, the fluid part of the blood after removing the blood cells. Normal value. Target to achieve. Normal vitamin B12 levels are usually above 300 picograms per milliliter, pg per milliliter. However, the normal range may vary depending on the lab. Remember that our goal is not only to reach the normal level, but to maintain the optimal level for health. Check more folate, vitamin B9, companion of vitamin B12. Folate, vitamin B9, also plays an important role in blood cell production and nerve function. Folate deficiency can cause symptoms similar to vitamin B12 deficiency. Therefore, doctors often request to check folate levels along with vitamin B12 for a more comprehensive view of your nutritional status. Complete blood count, CBC, overview of blood cells. Complete blood count, CBC, is another blood test that can provide important information about your blood cells, including the number, size, and shape of red blood cells, white blood cells, and platelets. CBC can help detect anemia and other blood cell abnormalities, thereby helping your doctor assess the cause of your symptoms. Low normal. Result: 200-400 pg per milliliter. Caution, alert. If your vitamin B12 test result is in the range of 200 to 400 pg per milliliter, your doctor may require you to perform an additional confirmation test. Don't be subjective if your test results are only slightly low. Confirmation test. Measuring methylmalonic acid, MMA, concentration, identifier of vitamin B12 deficiency. Methylmalonic acid, MMA, is a metabolite in the body. When vitamin B12 is deficient, the MMA metabolism process is interrupted, leading to high MMA levels in the blood. The MMA concentration measurement test is a high-sensitivity confirmation test, helping to detect vitamin B12 deficiency even when vitamin B12 levels in the blood are not too low. Other supplemental tests. Find the culprit of vitamin B12 deficiency. Depending on the specific situation, your doctor may require you to perform other tests to find the cause of the vitamin B12 deficiency. For example, an intrinsic factor antibody test can help determine if you have pernicious anemia. You should remember that the evaluation of vitamin B12 test results needs to be performed by a qualified doctor. The doctor will consider your test results along with your symptoms, medical history, and other risk factors to make an accurate diagnosis and appropriate treatment plan. The options for treating vitamin B12 deficiency. From supplementing vitamin B12 to choosing the right route. Vitamin B12 supplementation. Recharge your body. The main goal of treating vitamin B12 deficiency is to replenish the body's need for vitamin B12. The usual recommended dose is 1000 micrograms (mcg) per day. However, the doctor may adjust the dose depending on the level of vitamin B12 deficiency and your health condition. Vitamin B12 routes, intramuscular or oral. Vitamin B12 can be supplemented through two main routes. Intramuscular. Vitamin B12 is injected directly into the muscle. Oral. Vitamin B12 is taken daily. So, which route is better? Let's find out. Intramuscular versus oral. War of efficiency and convenience. Previously, intramuscular was often prioritized because it was considered more effective in getting vitamin B12 into the body. However, recent research shows that high-dose oral tablets, 1000-2000 mcg, are just as effective as intramuscular injections, even in cases of pernicious anemia. Advantages of oral tablets: convenient, easy to use at home, less invasive, does not cause pain like injections. Disadvantages of oral tablets: compliance, Requires patients to comply with taking the medicine every day. Absorption. Absorption may be affected by stomach and intestinal problems. Intramuscular is recommended in the following cases. Severe deficiency. Need to quickly supplement vitamin B12. Non-compliance with taking medicine. Patients cannot or do not want to take medicine every day. Have absorption problems. Patients have stomach and intestinal diseases that limit the absorption of vitamin B12 from oral tablets. Intramuscular treatment regimen. Normally, the doctor will prescribe intramuscular injections weekly for 4 weeks. Then switch to monthly injections. Treatment time. Long-term journey. In most cases, the treatment time for vitamin B12 deficiency is indefinite. This is because many causes of vitamin B12 deficiency, such as atrophic gastritis or metformin use, are usually chronic conditions and cannot be completely cured. Follow-up, monitoring the effectiveness of treatment. If you are being treated with oral tablets, the doctor will ask to recheck your vitamin B12 level after 2 to 4 weeks to ensure that the treatment is effective. Recovery time. Waiting for the change. Bone marrow usually responds quickly to vitamin B12 treatment, with signs of improvement visible within 1 to 2 weeks. Symptoms of anemia usually improve within 1 to 2 months. Nervous function may take 3 months to 1 year to recover completely. Change the route. Flexible adjustment. If you are being treated with intramuscular injections and are tired of going to the hospital frequently, you can talk to your doctor about switching to oral tablets if your condition has stabilized. The secrets to help prevent vitamin B12 deficiency. Supplement vitamin B12 daily. Weapon, optimal for prevention. The most effective way to prevent is to supplement vitamin B12 daily, especially if you have risk factors such as using metformin. Antacids, have stomach and intestinal problems, drink a lot of alcohol, or are vegetarian, vegan. The recommended dose for prevention is 1000 micrograms, mcg, per day. You can use vitamin B12 products from reputable brands, such as Thorne, or products that are easy to dissolve to increase absorption. Supplement high-quality multivitamin, comprehensive support for health. In addition to vitamin B12, supplementing a high-quality multivitamin can bring many health benefits, especially for older adults. Multivitamins can provide other vitamins and minerals needed by the body, helping to strengthen the immune system, protect the cardiovascular system, and improve brain function. Group B vitamins in multivitamins can help reduce homocysteine levels, a substance related to cardiovascular diseases. So we have come together on a long journey to discover vitamin B12. From its important role in the body to the causes of deficiency. Warning symptoms, diagnostic methods, treatment options, and effective prevention measures. Let's review the main points to remember. Vitamin B12 deficiency is a common problem in older adults. Vitamin B12 affects red blood cell and nervous system function. Vitamin B12 deficiency is often overlooked, but can be treated safely and effectively. Vitamin B12 should be checked in older adults with suspected symptoms or risk factors. I hope that the knowledge that Health and Life provides in this video will help you better understand vitamin B12 and know how to protect the health of yourself and your family. If you find this video helpful, don't forget to click the like button and share it with your friends and loved ones. And most importantly, click the subscribe button so you don't miss future videos with useful and interesting information about health and life. Thank you for following Health and Life. Goodbye and see you in the next videos.